Hi everyone. Over the next 3 minutes, I'll be providing a brief update on our study, Coach-Coordinated Enhanced Neonatal Transition, or CCENT, where we are testing new ways to support parents as their child transitions from the neonatal intensive care unit, also known as the NICU. Having an infant admitted to the NICU is associated with increased parental stress, anxiety, and depression. These emotions can be heightened during the transition from hospital to home, as families may feel a sense of loss when not being able to readily access healthcare providers. The study proposes and evaluates a new model for neonatal follow-up that provides additional supports to parents and their babies during their NICU stay and transition home. Parents were recruited if their infant was born before 26 weeks, born after 27 weeks but had one or more risk factors, those with two or more major congenital anomalies, and those with hypoxic ischemic encephalopathy. The CSENT intervention was delivered by nurse navigators who provided additional supports to parents in the NICU through 4 pillars: education, which was answering medical questions and providing resources; ongoing support in the form of weekly and monthly calls to check in; 4 sessions of acceptance and commitment training; and also system navigation, which empowered parents navigating the healthcare system. Diving deeper into one of the 4 CSENT model pillars, acceptance and commitment training is designed to foster psychological flexibility, which is the willingness to experience difficult events and choose actions in the present moment, aligning with one's values. ACT encourages people to embrace their difficult thoughts and feelings rather than avoiding them. Our team collected data over an 18-month period. At baseline, participants were randomized into intervention and control groups. The nurse navigator provided supports to parents starting at baseline and ending at 12 months for those in the intervention group. At this time, the primary outcome, which was parental stress, was collected. We also conducted qualitative interviews at 12 months. A total of 275 participants were enrolled in the study across 7 sites, which are listed at the bottom of this slide. Recruitment is closed, and we are now conducting quantitative and qualitative data analysis. Our team has also taken the time to develop resources through patient engagement, such as the family toolkit pictured below. In terms of other knowledge translation efforts, our team has published 3 peer-reviewed articles, shared 5 posters, and also given a variety of different presentations at different symposiums and conferences. Although our team is currently analyzing our data, we do anticipate improved parental stress, empowerment, and parent-infant interactions. We enhance support pathways embedded in neonatal follow-up, and we also hope to implement the CSENT model on a larger scale and focus on higher-risk infants. We'd like to thank everyone involved in this study, including the site investigators, nurse navigators, research assistants, patient and family partners, and participants, as well as ChildBright. Thank you.
The preschool years are a critical time in childhood and a time of great joy. But for families with a child who has or who is at risk for a brain-based developmental challenge, they can also be times involving significant stress as the family witnesses their child's differences and seeks help from services, often having to wait. That's where the Bright Coaching Intervention comes in. With the goal of empowerment and developed in full partnership with families, a coach and a family together explore themes that include understanding their child and their development, understanding the service system and how to navigate it, and importantly, supporting parents in their own journey as they parent their special child. The program involves a holistic and flexible approach, recognizing that different families have different needs.
The goal of the exit interviews was to explore participant perceptions about Bright Coaching, their satisfaction with the program, and their perceived impact of the program. We had 96 respondents to the exit interviews, and what we found is that Bright Coaching was highly rated by the majority of participants, where they have conveyed being very much satisfied with multiple aspects of the program. Participants also reported a gained sense of empowerment, such as an increase in their support, increased resourcefulness, increased or improved mental health, improved relationships, and also an increase in their knowledge and their awareness. Through the exit interviews, we also identified a few areas of improvement and challenges with the program, and those will be considered by the team during the implementation phase in order to optimize the intervention and also to optimize its uptake into clinical practice.
Thanks to funding from ChildBright, our next research project will study the various steps needed towards successful implementation of the Bright Coaching Program in 4 provinces across Canada. More specifically, our Step 1 objectives are to identify the key ingredients of the program that were vital to its success and to refine the program to enhance feasibility and acceptability. We will do this by triangulating multiple sources of data to refine the program content and format. Step 2, we aim to identify key barriers and facilitators at the systems levels that may influence the integration of the program and to select province-specific implementation strategies. We will also co-create a tailored implementation blueprint, providing a roadmap for the implementation effort. Engaging a diverse group of patient partners will be key to ensuring the acceptability and feasibility of the program. Active engagement of local stakeholders from each province will be critical to capitalize on a shared vision beyond our traditional care models to ensure successful integration and implementation of the Bright Coaching Program.
I joined the Bright Coaching Project in 2021 in the hope that I would share information that I have learned through my experiences. As a parent with a child with additional needs, getting involved with research helped me overcome feelings of helplessness. It is my hope that Bright Coaching will help other parents similarly and bring about the change needed in practice and policy.
When young people with brain-based disabilities turn 18, they are usually expected to go from seeing doctors who treat children to seeing doctors who treat adults, and to start taking charge of their own healthcare. This healthcare transition is set by policy and happens whether youth are ready or not. If the transition is not smooth, youth may experience negative health effects with missed appointments or medications, more burden on their family, and more costly emergency department visits. As doctors and researchers, we look for ways to give youth and families the best health and healthcare experience possible with the least amount of burden to families and the lowest cost to the healthcare system.
To work on a solution to the healthcare transition problem aimed to help youth get ready for their own healthcare transition, we partner with multiple stakeholders, including patients and families, to create an e-health tool or app along with a support website in both official languages. Using the app, youth take a step-by-step approach to developing knowledge and skills to help them start taking charge of their own health. App metrics tell us about the most used features and patterns of user activity.
Our randomized controlled trial, or RCT, aimed to recruit 264 youth between the ages of 15 and 17 years old to test if there are benefits to using the app compared to not using it. All study recruitment was in the context of the COVID-19 pandemic, and we were not able to complete our full-scale RCT. By December 2021, after 19 months of recruitment, we were able to randomize only 46 participants. A total of 39 completed baseline and 6-month follow-ups, 64% in Ontario, 21% in Alberta, and 15% in the Maritimes. Pilot work is ongoing, with 6 French participants recruited this year in Quebec. Overall, the 2 groups were comparable both in terms of average age of participants, which was 15.9 years, and gender, with 54% of the sample being female. We were able to recruit participants from all 5 diagnoses eligible for the trial, with autism spectrum disorder and cerebral palsy being most common in our sample.
From our Patient and Family Advisory Council experience, we can share concrete strategies to help guide research teams in partnership with diverse groups of stakeholders throughout multi-year projects. As a cornerstone of patient-oriented research, I'm proud to say that our project has embraced the idea of interpreting study data in collaboration with stakeholders. All stakeholders, patients, families, researchers, site investigators, and research staff are encouraged to join these conversations. We are looking into guidance from CIHR and models from other projects to help us plan theme sessions, working in subgroups over the coming months.
Our project results are focused on sharing our learning related to setting up a multi-site, patient-oriented research trial, co-creating an app with patients and families, the feasibility of recruiting and conducting a trial virtually, as well as information about experiences and benefits of using the app, ultimately informing future plans for the app. Our productivity is very much focused on timely dissemination and knowledge translation, or KT, between now and the spring of 2023.
We hope this video presentation has given you a good sense of the extent to which our patients and family members have been involved in this project and in the design of this transition app.